Kia ora. Dave here from Arthritis New Zealand, and thank you for joining us for this online presentation on fibromyalgia. So I'm going to share my screen. I've got some slides I'd like to share with you, so I'll just get those up. So as you may have spotted, the next slide is a thank you to Pfizer for their generous support in not only helping us with this particular webinar, but also a whole series of webinars. So they've been very, very supportive. So thank you. So this is what we're going to be looking at. It's basically a look at fibromyalgia. And I suppose the first question is, what is fibromyalgia? And I think it's a very good question, because I don't think there's any real consensus out there amongst clinicians about what fibromyalgia is. There's some theories around what it may be, but I think that no one has really got a full understanding of what's going on when people have got fibromyalgia. But we certainly know what happens to people who've got it, the symptoms. People with fibromyalgia generally have a whole range of symptoms, but the most common symptoms are chronic pain, which can sometimes seem to move around from one place to another, and fatigue, which can be really debilitating. So those are the two main features of fibromyalgia, but a lot of people get other symptoms as well. Things like cognitive impairment or fibro fog, where people can't concentrate very well, irritable bowel syndrome, migraines, depression, all these things, sometimes sensory disturbances. These have all been linked with fibromyalgia. So it can be quite a difficult condition to diagnose for a clinician, because all those symptoms I mentioned can be caused by other things. Pain, for example, could be caused by arthritis or some other condition. Fatigue may well be due to side effect from medication, or people might be anemic or might have a thyroid problem. There's a whole range of things which may cause these symptoms. So if someone presented to a GP with these symptoms, fibromyalgia may not be the first thing that GP is thinking about. And generally, if people have got those symptoms, there will be a whole range of tests that are done, including blood tests, sometimes x-rays, things like that. If you've got fibromyalgia and no other condition, then all those tests will usually come back as normal. So that's a bit unfortunate, because in the past, or sometimes still today, unfortunately, there are some clinicians out there who say this isn't a real condition because we can't find anything wrong on the tests. To my mind, it means the tests just aren't very good. There is a way of diagnosing it, and that is generally excluding anything else which may cause those symptoms, and then doing something called a tender point test, which is what this diagram is showing you here. So if someone is suspected of having fibromyalgia, then there should be a tender point examination, and there's 18 particular tender points which should be examined. If people don't have fibromyalgia, they generally feel pressure when those points are examined, but people with fibromyalgia will feel a lot of discomfort. So that's generally how it's diagnosed, excluding anything else which may cause chronic pain and fatigue, and a positive tender point test. Not a great way of diagnosing it. So once people do have a diagnosis, and that can sometimes take a long time, I think the average time to get a diagnosis is 5 years, I think, which is a long time for people to have those symptoms and not have any answers to why. So if it's an average of 5 years, then there will be people who go much longer than that, and sometimes people will not get a diagnosis at all. So I'm sure there are people out there with fibromyalgia who haven't actually been diagnosed. So it's difficult to diagnose and difficult to treat as well. So those of you who've got fibromyalgia will know this. The treatments sometimes can be a bit of a problem. Sometimes they don't work very well. Sometimes the treatments themselves cause problems. But I thought I'd have a look at them, the common treatments that are used. Most people with fibromyalgia, when it comes to the pain, have usually tried lots of things anyway before they even get to a diagnosis. So quite common for people to try non-steroidal anti-inflammatory drugs or things like paracetamol and codeine, these sort of things. And you'd expect those drugs to work reasonably well for conditions like arthritis, but what we find with people with fibromyalgia is that those treatments don't work very well, if at all. So generally, clinicians will use other treatments to treat fibromyalgia symptoms, and one of the most common ones is amitriptyline. Amitriptyline is a low dose, used in fibromyalgia in low dose. It's an antidepressant, but it can help with people's sleep, and it can help with pain as well. So generally, that's why it's used for fibromyalgia, because a lot of people with fibromyalgia get sleep disturbances as well. And if you can't sleep very well, or you have sleep disturbances, it tends to make all the other symptoms worse. So trying to get people a good night's sleep is really key. Nortriptyline as well, it's similar to amitriptyline, probably a little bit more effective, and they're thought to have fewer side effects. But again, it's an antidepressant. So these are all prescription drugs. You can't buy these over the counter. You need to get these from a GP or a clinician. Some other commonly used treatments are these anticonvulsants, sometimes used in epilepsy. So gabapentin, pregabalin. And they can be used, they can be quite effective for chronic pain. But like all medications, they've got some potential side effects. And I know that people sometimes can't tolerate these medications because they find the side effects too much of a problem. Venlafaxine is another one that's sometimes used. It's another antidepressant. Tramadol seems to be quite effective for fibromyalgia pain. So some of you may have some experience of that. Problem with tramadol is it can be a little bit dependency forming, so that's sometimes an issue. This is quite interesting. Low dose naltrexone, I think this is not commonly used, but there does seem to be some evidence that it may be useful in chronic painful conditions. Naltrexone is a drug used in substance abuse, but it does seem to also have this effect of being possibly effective in chronic pain for conditions like fibromyalgia. There are some other treatments which you don't necessarily need a prescription for, things you can buy over the counter from a pharmacist. First one is, fibromyalgia is an example of a magnesium supplement. In this case, it's combined with malic acid. The combination is thought to be effective in fibromyalgia. Coenzyme Q10, or a more potent version, is MitoQ, more expensive version as well, but that seems to be effective for some people. And ginkgo biloba extract, these are all things that have been reported to me by clients as being helpful in fibromyalgia. So then we go on to other treatments, which are not necessarily medications. Cognitive behavior therapy, this is a well-established treatment, and it can be very helpful for things like chronic pain and other conditions as well. Usually delivered by a clinical psychologist. And I'm not a clinical psychologist, but my understanding of CBT is that it's designed to get you to think differently about your condition, think more positively. And what we know is if you can get rid of some of those negative thoughts around some of these conditions, you can actually make it easier to deal with them. Massage, I know that massage is reported to be helpful for a lot of people with fibromyalgia, providing it's the right sort of massage. I know that some people find that some forms of massage actually exacerbate the symptoms, make them worse. So if you're thinking about massage, you probably need to talk to a massage therapist who's got experience of dealing with people with fibromyalgia. Meditative movement, so these things like Tai Chi, can be very helpful. There's some evidence that is helpful for some people with fibromyalgia. Mindfulness or mind-body therapy, this is not a new thing. People have been doing this for centuries. But mindfulness is quite a new term, I suppose. And it's just a way of trying to get you to be present in the moment and not be worrying about things that have happened in the past or worrying about things that might happen in the future, just to take some time out and actually be present. So as the diagram there shows, trying to be more like the dog on the walk rather than the person taking the dog for a walk. The dog's just thinking about the walk. And so people can be trained to think this way. and that can be very helpful. Hypnotherapy, I'm not sure there's any particular evidence around hypnotherapy, but it may be something that people might want to explore. Acupuncture, I know that a lot of people report that acupuncture is helpful, but I also know that some people find it actually exacerbates the symptoms and make them worse. So you probably need to approach that with caution, really. Some physiotherapists will offer acupuncture, so it may be worth exploring that. Exercise, we know exercise has got a beneficial effect, not just for fibromyalgia, but for lots of other conditions as well. The problem is that a lot of people with fibromyalgia find that some form of exercise is quite painful. So it's probably difficult for them to find the right sort of exercise for them. So, we would say, think about seeing a physiotherapist, think about things like the green prescription, which are options out there. Probably the key with exercise is finding something you enjoy, because if you don't enjoy it, you're not going to continue to do it. So it may be getting involved with a group or doing some exercises at home. But if you can find some sort of exercise that keeps your muscles strong, which is really important. A lot of people with fibromyalgia get muscle deconditioning, and that actually makes them more susceptible to injury and creates this like downward spiral, if you like, of chronic pain and injury. CBD or medicinal cannabis, this is a bit of a hot subject at the moment. There are conflicting views. You'll find some clinicians are not really in favor of this, and you'll find some clinicians who are. In New Zealand, it is legal. You can get this legally if you can get a clinician to prescribe it. The problem is if you pursue the legal route for this, it's usually prohibitively expensive. I think at the moment we've got Sativex and Tilray available on prescription, but you're talking hundreds of dollars a month for those prescriptions. So a lot of people can't afford that. But there does seem to be a lot of people do report that CBD oil is helpful in chronic painful conditions. Hydrotherapy, getting in the water and doing some exercise, has got some really good evidence that it's helpful in fibromyalgia symptoms if you've got access to it. During our COVID-19 lockdown, this was a bit of a problem because people couldn't access these really great resources. But thankfully, if we stay out of restrictions, then people can go back and start using these facilities again. And then there's some online resources. So Health Navigator is a really great resource. It's a New Zealand-based website being put together by clinicians, and it covers a whole range of conditions. So here's the page on pain management, but they have got pages on fibromyalgia management, arthritis management. So it's a really great website to get onto. So I'm guessing because you're watching this, you can access the internet and should be able to access Health Navigator. This is another useful website, I think. It's a University of Auckland website called CALM, which stands for Computer Assisted Learning for the Mind. And this is a really great resource they put together and talks about lots of ways that you can use things like, things like managing stress, anxiety, and depression, all very useful, particularly in chronic conditions like fibromyalgia. There are some other resources out there. You may have heard of this Gupta program. It's named after Ashok Gupta, who is a UK clinician who developed chronic fatigue syndrome. And he developed his own theory around what chronic fatigue syndrome and fibromyalgia is. I mentioned at the start, there are some theories around what fibromyalgia may be. His theory is that fibromyalgia can be caused by an overactive amygdala, which is part of your brain. And he reckons that that can actually cause sensitization of your nervous system. Your amygdala is involved in the stress response. So I think this program is about trying to find ways to de-stress. You can actually access this program, but you need to exercise a bit of caution. Obviously, there's a cost to this program. If you go onto his website, you'll see lots of testimonials from people who found it very helpful. But you would expect to see that from a website that's trying to sell you a treatment. Having said that, it may be very useful. And I've not had any feedback from anybody, any of my clients who've tried it, so I don't know. But I know it's out there. as is MICKEL therapy. This is a similar sort of approach, named after another clinician, Dr. MICKEL, another UK clinician. But his theory is similar to the Gupta theory, but he thinks there's a different part of the brain involved, which is the hypothalamus, causing similar issues. And so that's interesting because the hypothalamus is the part of the brain which is involved in temperature regulation. And we do know that a lot of people with fibromyalgia do report these abnormal responses to temperature. So there may be something in it, but again, there's a cost to that program. And then there's, this is neuro-linguistic programming. This is the New Zealand organization offering neuro-linguistic programming. And I've had some pretty positive feedback from people who've tried this. So it does seem to be effective for some people. It's expensive though. So, you know, they have to bear that in mind. But it may be worth exploring that. Then there's some other resources out there. There's this Fibromyalgia News Today, which people can subscribe to, but you can actually go onto the website and find a lot without having to subscribe. But this seems to be the place you can go to find out where all the latest information and research is on fibromyalgia. I think it's an American-based website. And then there's some apps out there. People, you know, like to use apps for lots of things, and there are some apps you can go onto which may be useful. The Health Navigator site I mentioned before is aiming to be the go-to place to find which apps are appropriate for your condition. So if you're thinking about trying an app, then perhaps try out the Health Navigator site I mentioned earlier, just to see what's available and, you know, if they recommend them. This is an example of a chronic pain app. I've had some really positive feedback from clients who've tried this, but it's not the only app out there. And as I say, there is a cost, and it might not be for everybody. But I've had some good feedback from people who've tried this particular app. And then there's our services and what Arthritis New Zealand can do. We've got our website, and there it is. You'll see there's a donate button at the top there. So we are a charity, and we can only provide services like this if we get the funding. So do encourage people to go on there and donate if you're able to. So we're always grateful for people's donations. But there's lots of things on our website, tells you what we're up to. You can find lots of information about most of the common forms of arthritis, and that includes things like fibromyalgia. There's some really great resources on there. We have online support groups as well. We have actually got support groups that meet physically throughout the country, but we've also got online support groups as well. And there is a fibromyalgia online support group, which is what this is here. I like to go on there every now and again and just check what those guys are up to. It's a great resource for people. They can share their experience. And I think these are the guys who are really expert at fibromyalgia. They're the ones living it day by day. And usually have got the time and resources to actually look into it more deeply. So I think these guys probably are a bit more up to date with things than a lot of the clinicians out there. So it may be that you might want to, if you use Facebook, then this is on an online support group available through Facebook. Just a reminder of our services. So we've got our 0800 number there. It's a free number. Anybody can call that number. From anywhere in New Zealand, it's a free call, and speak to one of our team. We've also got our email address there, which is info@arthritis.org.nz, where you can send inquiries in by email. We've got 3 offices in New Zealand. We've got one in Auckland, one in Wellington, and one in Christchurch, and those are the details there. Just a reminder of some useful websites. Our own website at the top there, versusarthritis.org, that's a UK website. Lots of really interesting research on that website, particularly around arthritis. And Health Navigator, mentioned that earlier.